Well, hello everybody. Thank you so much for joining this SpendMend webinar. We have quite a program planned today. I'm watching the attendees kind of just climb up and up and up. We have several hundred people joining today. It promises to be a great presentation, and we've absolutely packed the house. We have a fantastic panel for you today. We have Ashley Maines Espinoza, Pam Lath, and Jake Thompson, and I'm going to get into their introductions in just a minute. But I did want to say this is about 340B ESP, to send or not to send, and that's from a CE's perspective. Today we're going to be covering off on a couple key topics. Go ahead and advance that, Jake. Really, this is about the 12 manufacturers that have put 340B pricing restrictions on contract pharmacy networks. There's a lot of great information coming today, but it can be a little bit nerve-wracking. There's a financial impact that is very significant, and covered entities are considering sending qualified claim data to 340B ESP. So we really have to understand which manufacturers have the contract pharmacy restrictions in place. How do you discern if you should upload claims to 340B ESP? And if that's the case, how do you submit to the 340B ESP online portal? All of that and much more will be revealed today, and then we're going to make quite a bit of time for your questions. Now, I want to get into intros, but before we do that, let me just do a quick bit of housekeeping, because there's a lot going on today. First and foremost, we're planning on about an hour presentation today. We have 1 hour presentation. That's going to consist of about a 30-minute bit of information that the panelists are going to provide to all of us. That will include a few poll questions. So we'll sit in, we'll listen to 30 minutes. The poll questions will come up. You go ahead and just click the box on the screen. We'll produce the results right in front of you. And then we're going to get into a 30-minute Q&A. And in our experience, that will be really the meat of today's presentation. Questions are going to come in. A lot of this is sort of real-time information. We may have to defer some of the questions that come across because we might have to do some research. We don't want to give any misinformation. But every question we get, we're going to type out and send an answer to the asker. We'll post a lot of it on LinkedIn or social media once we get it. And then we're going to cover a lot of the questions in our 30 minutes at the end of today's presentation. You should find a chat box floating somewhere on your screen. You can go ahead and type questions right into that box. And I do want to make very clear, we will be emailing a link to this recording tomorrow. So if you like what you saw, or if you want to share this, if you want to watch it again, if you want to share it with a colleague, you will be getting a link to the recording to replay. Now, without further ado, let's get into our esteemed list of panelists. I'm going to start there with Ashley on the bottom. That's Ashley Maines Espinoza. She is a third-generation pharmacist based in Denver, Colorado. She serves as the Director of System Pharmacy Business Services at SCL Health. That's a faith-based nonprofit health network. She's held a variety of leadership roles in informatics, inpatient and ambulatory operations, revenue integrity, procurement, and intern development. Dr. Maines Espinoza, she approaches a decade of experience in the 340B space, and she's represented every single kind of covered entity you can imagine. And also, if you look on her LinkedIn profile, she clearly states that 340B is her jam. I think that's worth noting. Right there in the center is Pam Lath. Pam is currently the 340B program manager for Day Kimball Hospital. It's a nonprofit DSH independent healthcare system in Northeast Connecticut. And throughout her 20-year career as a nationally certified pharmacy technician, Pam has been involved in a variety of different aspects in the whole pharmacy world, including IT, billing, quality assurance, operations, purchasing, and of course 340B, and that's both mixed use and contract pharmacy. Over the past 2.5 years, Pam's brought her 9 years of 340B knowledge and experience to 340B contract and specialty pharmacy program management arena. She finds this exceptionally challenging and very rewarding as well. Pam, Ashley, thank you guys both so much for joining us today. You're really making this a panel of experts for us, so we really appreciate your time.
Thank you for having me.
Of course. And then to round out our list, we have our very own Jake Thompson. Jake got his start in pharmacy years ago in the year 2000. He's held nearly every position from technician to intern to chief of pharmacy. Around 2019, Jake started his own company because he wanted to really focus on spreading his knowledge of optimization across other pharmacies, and that company was called Elevate 340B. That was the optimization division of Turnkey Pharmacy Solutions. 2 years after founding that, Turnkey Pharmacy Solutions, the entire group was sold to SpendMen, and now Jake works with me at SpendMen, and he is the Pharmacy Optimization Division leader. Now, Jake, I said a lot there. I think it was appropriate to provide introductions to this great panel. Let me hand it over to you, and I will come back on at the end, and I'll walk us through the Q&A. But for now, let me leave it to this esteemed panel. Jake, take it away.
Yeah, thanks for the introductions there, Tom. A little bit more detail on our agenda today. Quick introduction on who SpendMen Pharmacy is, and then we're going to round out the issue at hand. What's the situation with all the manufacturers? And then our core question, how do you as a covered entity decide what to do with that information? We'll see what's being done out in the field. We'll hear from both Pam and Ashley. And then if you do decide, we'll give you a glimpse of what it's like to actually upload those claims in 340B. Before we get going, let's just get a quick poll on the audience now. You can see, I believe you got a poll coming on. If you could tell us if you're here representing a hospital covered entity, a grantee, other, or maybe you're a partner, consultant, vendor in the space, and I'll give you time there, and we'll see what the results are. Couple more clicks coming in, and we'll see what the results are. And Vanna, what's the results here? All right, so 85% of you are in the hospital space, and then you can see the rest. Let's do one more, and then we'll kind of get started. Give us how has your organization interacted to date with 340B ESP? 3 choices here, nothing. Second choice, we've signed up and enrolled a pharmacy, but we are not submitting any 340B qualified claims. Or 3, we have submitted 340B claims. And we'll give this just a few seconds again to let everybody click through. All right, and the release here. All right, so 3/4 of y'all have not done anything. And then 20% have enrolled one pharmacy, but not the claim. So great, I think you're gonna benefit tremendously from the conversation today as you continue to discern which of those 3 buckets is right for your organization. So thank you for that. Quickly, who are we? We're the largest 340B team in the country. We've got over 500 trusted hospital and clinics who partner with us, or we partner with them to help them with their 340B program. We've done over 1,500 independent audits, set through more than 100 HRSA audits. We have a past HRSA audit on our team. We trained 2 out in the field, and we're vendor neutral. We work for covered entities. Our team's made up of an all-star cast, all come from covered entities. Part of them wake up every morning and focus on 340B compliance. The other half wake up and focus on the financial aspect of 340B. But to summarize it, you know, we've all got 340B tattoos. We all just do 340B. It's what we wake up and breathe and do every day. But enough about us. Let's get to the issue and the topic at hand. The issue at hand really is not new to any of you, which is why we've got such a large crowd on today. But the real issue is, what do we do and what are the nuances? So in preparing for today, what we want to do is put a clean chart out there. And so you could kind of see how the manufacturers are shaped up. As you're probably aware, every one of them has slightly different policies, different rules, and can impact you at a covered entity differently. So you can see the 12 listed there with a reference on the right of their actual policy. We aren't going to get into the nuts and bolts of every single one of them. That would take up too much time. But what we have done there is said, hey, of the manufacturers, which ones can we elect a single or some places 2 pharmacies without uploading claims, or have your owned outpatient pharmacy. That's in the second column there. And then the other column is that if you were to decide to upload to 340B ESP, which ones will give you the 340B pricing back to your contract pharmacy network? And this is very important that you understand each manufacturer and each of those 2 pillars. And when we talk about discerning the decision in a bit, you'll understand even further through there. I will caveat this is updated as of this week. We did incorporate the new changes with Novo and noted there where you can add a specialty pharmacy, but this chart is constantly outdated. It won't be surprising to me if next week there'll be something different on this chart. So you'll have this chart as a reference to get going. Certainly important to stay tuned as you understand the changes that manufacturers have. But for today's webinar, we're going to focus on those 2 columns. Which ones will allow you to have a limited number of contract pharmacies, and which ones will allow you to have sort of your normal contract pharmacy network and pricing. A couple other high levels about the issue. Grantees, not very many on the call, but for the most part, the restrictions exempt the grantee sites. So we're really talking about the hospitals in the program. And you might be thinking, well, what about the lawsuits with the manufacturers? That's a webinar all into itself, probably longer than an hour. So we're not here to get into where each lawsuit is with each manufacturer in that stage. However, we'll point out that we don't believe this decision about uploading data or not uploading data will impact what the courts actually do. Maybe early on, the adoption rate with 340BSP we think was important, but nowadays those things are all on path. They are all unique, and what Utica covered entity does will not impact how the judge and the appeals courts and such play out. You heard me talk about it earlier. What about signing up just one pharmacy? We're not going to talk about that process. We've got a link there to make sure that you've got an HIN number and how you can go about and do that. So there's a reference there. Certainly going to talk about when you do the financial discernment, but we're not going to get into the nuts and bolts of how you would register one of the pharmacies today. And so to summarize, before we get into the pros and cons list here is, what should I do as a covered entity? We're not here today to tell you what the right decision is and what the wrong decision is, because there is no wrong and right decision. What's most important is that each covered entity review their state, their program, what it is in their community, and make the decision. So, well, that's easy to say, not as a little bit harder to do. So let's help you organize that, because your job on the call here as a 340B, as a pharmacy leader, is to take that complex chart and really organize it for the rest of the stakeholders in your organization, right? And so the first and most important thing that has to be done is to understand the financial impact. And that's what this all thing is about. This is about the dollars, right? Nobody wants to be doing this. It's about how much dollars can you continue to have in the organization. And so how do you do that, right? Well, again, there's a lot of TPAs where you're qualifying claims. Go in there, run your qualified reports to understand which manufacturers your patients have qualified claims for, and understand what that fiscally looks like if you were to select just one pharmacy for that manufacturer of set of NDCs, or if you set them all. And therefore, when you have this discussion with your leadership, you can say, option one pharmacy, here's the return. If we do a 340B route, or 340B ESP route, here is what the bigger pie looks like. So you can bring that to the table. The other pro, if you think about, or some covered entities might have in play, is that if you have a charity program where 340B savings is passed along in that charity program and those claims are no longer qualifying, that hits patients negatively and their access to drugs. So look at any of the charity care programs that you have. Look and see which of those claims that patients are directly benefiting from would also benefit from this from this decision. And then second is right, okay, I know what the dollar value is. What's the non-tangible aspects of this? Well, the first one is dollar-wise, again, and this is really more impactful if you have a health plan or if you have a large employee base. Because if you upload claims to 340B ESP, those RXs will be removed from a rebate accumulator. And if your health system is responsible for those covered lives, those rebates will stop coming in to the larger health system or the group that you are responsible for. So getting somebody from the benefit side of the organization to help sort of maybe put an estimate on what that could look like. Again, because the financial upside on the left side isn't dollar for dollar, there will be some hits on the rebate if you do submit claims to 340 BSP. The next bullet point there, a lot of us have talked about, very much true to everybody's heart. Why do we want to send in this data? Why can we trust 340B ESP? What are they really going to do with it? What are the manufacturers going to do with this information, right? So certainly got to have that conversation internally with your compliance and legal team in the stakeholder conversation. Third, what about the extra work? This is going to be, somebody's got to do this. That needs to be part of the discernment. Later in this webinar, we'll sort of talk about what that work looks like up front and ongoing, so we'll help you there. The other cons are really looking at your PSA, looking at your TPA. And I wish we could summarize all those for you, but there's PSA languages and contracts come in all sorts of varieties. There's a dozen plus TPAs with different functionality to make sure that you can actually do this process of uploading claims and then being able to carve in those manufacturers that are blocked at your covered entity. So making sure you understand exactly what your PSA says you're bound to and what your TPA will actually allow you to do this. So to sort of summarize, right, take the chart, use your TPA, understand the upsides to the fiscal decision of a single pharmacy or your current in-house pharmacy, and what it would mean to upload to 340 BSP to be able to get all of the manufacturers that will allow it, and then offset it with the cons. And if you wrap that up, get all the stakeholders into the conversation, and that's when you can then try to get the organizations to make a decision. And so now that we've done that, give me a chance to step aside and let's hear from a couple covered entities and their process. So I'm going to ask Ashley to go first and then Pam. But if both of you could just sort of introduce yourselves and your roles, your organization, and then the journey that your covered entity has went through and how you came to that decision. So Ashley, I'll turn over to you first.
So I'm in the camp of hold tight. There's a couple things that are important to talk about. Number one, everybody's 340B identity and what makes up your universe. If you've been audited by HRSA, that universe term is really all of those areas. Your particular identity will drive what that benefit and how much it hurts looks like to you. We are in a unique position in the way that we maximize the exceptions. I recommend that all covered entities maximize the exceptions as soon as possible. So getting to know what those are, doing the going under the timelines that it is, and then working with your wholesalers and others that are giving those drugs to check on that. So maximizing it is not just sending that email, but it's following it all the way through. That's something that takes significant work. We've struggled with that, but it's what has helped us keep into the hold tight scenario. It is hold tight, and I'm glad that it's worded that way. It's not a binary yes or no, because this is a dynamic situation, right? Our unique position has allowed us to do that, and so I wanted to make sure that you all understood that this is a dynamic for us. And with the number of other stakeholders that Jake mentioned, benefits, other executives, folks that maybe you even haven't thought of working with yet, those folks are really important to the conversation. So we're at a hold tight today.
All right, thank you. And Pam, you want to same, or Ashley, you want to say any more?
Let me address maybe the other boxes. I wanted to pause there that's the biggest piece with maximizing exceptions. Some of the other things with philosophically, the way that we approach this is I don't necessarily want to say that those that are doing it are it's wrong, right, or indifferent. But as we go forward, and we are talking about data all the time, I want to in my own approach to this. So this is my personal opinion about the normalization of data submission. That data being, oh, this is the new normal. This is the way that it is. This is us responding to a situation. So unless the statute ends up being opened up in order to do that, it's something that I think that we ought to revisit to say, why is this required, and do we have to do this? Also, I want to talk about that future risk thing. There's significant future risk, not just the cons that were on a previous slide, but we're looking at all future impacts, not just in the courts, but what are manufacturers going to do? ESP and Second Sight Solutions, Berkeley Resource Group, they're a company, right? They want to make money. And if there's a large amount of data, will they use that as leverage? Can they use that as a marketing ability to get more manufacturers? Are we going to encourage more manufacturers to participate? That's a question that we're asking ourselves, and the future ways of what loss feels like. There's also political implications, again, right, wrong, or indifferent, with additional data that may be used to make white papers, approach Congress. How do we feel about that? And that concludes my thoughts on the matter.
Hey, Ashley, there was a question about expanding a little bit on maximizing exceptions. If there's anything else you wanted to mention about that, it just had come up in the chat.
One of the things that I've seen over time, earlier on, late 2020, throughout 2021, we have seen manufacturers change their tune. So if you approached a single manufacturer with one single request, it used to be that one pharmacy model, and we've seen that expand over time with many of the manufacturer participants to all covered entity owned or all wholly owned pharmacies. Make sure that you aren't operating off of the original definition of that if it has expanded, you're taking advantage of that, first of all. And then second, it is worth a unique conversation with the manufacturer saying, we believe that this particular pharmacy I forget which manufacturer it is, uses the term like common judgment or makes sense approach, that it would be included because of that identity. That's part of maximizing it too. The worst they can say is no. So those are two additional points of maximizing that. And then I'll harp on it again, following it all the way through, working with your wholesalers and confirming, did I get that price on that purchase? And it's actually something that we've worked with Turnkey on to compare some of our purchases and finding examples of, this was after we applied for the exception, we should have gotten that price, and then going back to the manufacturer saying, hey, we should have got that price.
Yeah, all great points, Ashley. Thank you so much for being on and giving that, and I'm sure more to come in the Q&A. Let's shift the coin over a little bit. Pam, want to introduce yourself and the discernment pathway at Day-Kimball?
Sure. So I'm Pam Lath. I'm a certified pharmacy technician and the 340B program manager for Day-Kimball Healthcare. We're a small standalone disproportionate share hospital in northeastern Connecticut, and our program's been focused on med management with a dermatology clinic and an oncology clinic mixed use with our acute care. We do not currently operate in outpatient pharmacy either. When manufacturer restrictions began, our 340B team felt the need to stand strong with the other covered entities and not allow manufacturers access to our data for varying reasons Jake has mentioned, and Ashley as well. The initial manufacturer restrictions had very little impact on us because they were based mainly on diabetes medications, not our main focus. Excuse me. Once we got into Sanofi's decision to restrict pricing for their medications, that was the first one that really hit us, and we decided to go ahead after conversing with Jake and talking with our 340B steering committee. We decided to go ahead and register one of our contract pharmacies to be able to take part in the 340B pricing for them. Then Amgen came in, and that hit us hard. That was our breaking point. We could either choose to do the single contract pharmacy again, or we could choose to go to the 340B portal and go ahead and submit claims. Designating one of ours was not going to work for us. That's where our break was. After a few conversations with leadership at DayKimball and with Jake and with our steering committee, we decided to go ahead in January and start submitting claims.
Thank you, Pam. I think the common theme, I stressed it early on, both of you hit on it, is the dynamic changing of this environment, both from a manufacturer's perspective, but what that means to the CE, and when do you do what, right? And so again, no wrong, no right answer to this stuff. We just want to be able to help you continuously try to make sure that the organization is making the best decision for it. And what that is this week may be different if a 13th manufacturer comes on, or maybe it's not if one of the 12 makes a policy change in your favor. So thank you both. We'll get to some more questions and answers in one bit. So now that you've heard from the two covered entities on sort of the yay or nay, one of the major considerations is, well, if I decide to, what does that mean, right? So this is our attempt to sort of walk you through our experience and our thoughts to date on this. So should you decide to go ahead and go forth, you've got to register. And the registration's like any other website. It's pretty easy to create that with your 340B ID. The only two aspects to really think about ahead of time is download the policies, the terms of use, right? And make sure that the legal team in your discernment has done that. So when you get to register, you're not reading that for the first time. And then second, somebody's got to be there to be designated as, an authorizing signer to say that you can do that. So just make sure you know who that person is and can log in and then delegate that task out. But when you create the username, those are sort of the two major aspects you're doing outside of basic demographic information. Next, once you're in, what 340BSP asks you to do, and there's a link there that sort of walks through here, and I apologize for the fuzzy pictures. We didn't screen capture ourselves and didn't anticipate doing a webinar. So this is from that link. So I apologize for that, but I think we'll get the point made. The first step is building a data template that you can upload. And 340BSP will take a lot of data, but they only require 7 fields. Right, so why give them more? We've talked about that as a con, minimize that data that you're giving them. So you see that there, the 340B ID. What's the date of service on the prescription? Well, when was it written or prescribed? What's the NDC, what's the quantity, and what's the RX number? And then finally, what's the NPI of the pharmacy? So that's what you've got to be able to do. And when you upload that for the first time, they'll ask you to map those fields over. Well, if you use that terminology, it'll be word for word. So it'll be really easy for you to do that. So that way, in the future, you follow the same format. It knows what the data is in each of the cells. So this is a one-time upload and process. One tip, making sure that you've got those NPI numbers of the pharmacies as you're starting to get this data ready. Some of the TPAs, the reports have it in the qualified line, so it's really easy to grab, but not all of them do. So you can get that in various places. The PSA, in your PSA, oftentimes it's in there. Maybe there's another report in your TPA, or you might have to ask the pharmacy itself. But it is a required field. You can't move forward without it. All right, so you've uploaded the template. Then what, right? You're going to submit your first data. And so what you want to do is get that templated out, create a new file that's going to have the naming convention of the date range, download your TPA qualified reports that you're going to have to upload, and then you're going to copy and paste those required columns. They're pretty common in all of the qualification reports outside of that MPI number. And so copy and paste them one by one by one. And then when you get through however many TPAs you have, you know, maybe you've got one, maybe you've got four, you've got to go capture them all. Save that document, and then it's like normal website where you can upload and attach your data. And what will happen then is your data will come into the screen, and it will check for any errors. It will flag the cells that have errors. That's happened a couple times already, where there's spaces after an RX number. That'll flag as a red cell, and you can't move forward. If there's a dash in, say, the RX number, that will stop it as well. But it's really easy. Whenever the error comes up, it gives you the opportunity to remove the file. Then you go to the file. It shows you what the cell errors are and where they are, so then you know which cells to go find the problem. You correct it, save it, re-upload it. It'll come back and look blue like this on the screen. When you upload it and save it here on the right, what happens is the magical powers at 340BSP de-identify that before it actually goes across the line to 340BSP. So you will see on the screen your data scramble to what you see on the screen with different letters and symbols, etc. And then you can save it. So then there'll be a save, and that will come up. So again, first time you've got to upload a template. Second time you're going to get all your data in it, upload it. It'll check for errors. If there's no errors, it'll hit save. It was a pretty seamless process, even with errors. Very intuitive to be able to get that done. Obviously, the number of pharmacies and the number of reports you got to go grab, it dramatically can change how much time it takes to compile this data. But fortunately, right now today, it's only 7 columns. And I stress that because we all go sign up tomorrow. They may all of a sudden require 10 data fields, right? So then what do we do? So it's that dynamic thing we're talking about. Right now, it's 7 data fields. A couple other tips folks have asked about is, well, do you go in and delete all of the NDCs in the qualified report that aren't impacted? And so 340B ESP will go through all of those, and it only uploads and saves the ones that are impacted by the manufacturer. And I felt comfortable when I saw that process happen, because your Excel document may have 300 claims in it, and then in the portal, when it's all said and done, it'll say there's 50 claims that were submitted. So you have a little bit of a check to see that there were only 50 claims that went sort of de-identified and went through to 340BSP, even though your file was much more. The other tip, if you can, 2 monitors. Now's the time. If you don't have 2 monitors, take this PowerPoint and ask your boss for 2 monitors. It'll make your life a lot easier. 1 Excel on document on one side, 1 on the other. It just makes it a lot easier to be able to copy and paste. So a little bit of logistics there. So you submitted for the first time, now what? So when you're in there and you submit for the first time, you're going to notice quickly it says your next submission's due in 15 days. And you're like, wait a second, that's not monthly. And you're right, it's not monthly. We've emailed them, and the response that we've gotten thus far is, we encourage you to submit data twice a month as you have it available. And the point I made is that oftentimes these claims are audited monthly, and so people don't want to have to do this twice a month. My sense so far is they just want to get your data. We don't know for sure if you do it every 30 days, if that will impact if pricing gets turned on and off and flips. I don't anticipate it is, but it's something we're going to watch for. So I do think you can get away with every 30 days. But again, dynamic, we'll find out over time if it really is every month or if it's twice a month. Second, they stated that it takes up to 10 days for that pricing to be turned on with the wholesaler. So you got to kind of hang out and wait for that. And Ashley stressed it, and I want to stress it. This is where you got to really start to get to work, right? You did all this discernment, decided to do it. You got to make sure it's as intended. So a spreadsheet. You got to track these manufacturer indices for every single one of your contract pharmacy wholesaler accounts to make sure that they got turned on. And it doesn't stop there. You also then need to make sure that your TPA settings are appropriate, because if you block them from qualifying or block them from splitting your TPA, you still aren't going to get these claims to qualify. So you got to do that by manufacturer at each of the wholesalers and each of your TPAs. And that's the work I think is the biggest workload in all of this. But fortunately, it should be a one-time lift. And then you move into this monitoring phase, right? And then you're monitoring like you normally would your qualifications and the financials and things like that. So a little bit of work after you submit your first data. So let me summarize this here before we start to take questions. You've heard it multiple times. This decision's not easy. It's complex. It's dynamic. It's your decision at a covered entity. There's no shaming if someone needs to hold, if somebody needs to upload. It's what each organization needs to do. 340B ESP was fairly easy to upload, fairly intuitive as it sits today. So not as much workload as I anticipated when you upload claims. But the most important thing is track. You got to start to really make sure you're dotting all the I's, crossing all the T's, that these accounts stay with the 340B price, that your claims are qualifying appropriately for each of these manufacturers. So I want to thank Pam and Ashley again. Thank you both for coming on. But now we want to hear from you. So I'm going to turn it back over to Tom, and he'll help get these questions asked, and we'll do our best to answer them. Tom?
All right, you guys, we're good. And thanks for that, Pam, Ashley, Jake. Great information so far. We're seeing a lot of questions come in. I'm going to go through more or less in order. So some of it may be disjointed, or we may return back for one section of the presentation back to another, and then so forth. So just bear with us. If you submitted a question and we don't cover it, we're intending to write answers to all these and send them out to you. We'll post a couple on social. Some people there's some questions about the information. We'll look into all of those questions here. I also want to say there's questions about, we are recording this and we're making that link available in an email that we'll send tomorrow. And also the handout, the slides associated with this presentation are available right now in the WebEx, the GoToWebinar box. You can find that in the handout section. So let's just jump into these questions here. First and foremost, do we know how many covered entities are sending information? If 1/3 of entities send data to manufacturers, if 1/3 of manufacturers probably have all the data they need, but there are only a couple, then they probably really need more data to see patterns.
Yeah, it's difficult. There's not an easy data piece to get there, but I'll tell you, from our client base and talking to other folks who interact with a lot of covered entities, we're estimating about 10% of covered entities are utilizing 340B right now and uploading claims specifically. I certainly do think that number will increase dramatically in through Q2, and it won't be shocked if half of the covered entities are before the summer conference. But Ashley, I know you interact with tons of folks, peers. What's your sense? Oh, 1 second here.
There we go. I needed help unmuting. I've talked to a large number of people, and what I've heard is we've reached the tipping point. So that's the tipping point of, at a minimum, having the conversation. I don't believe that it's 100% a tipping point of must do this now. I'll reiterate what Jake said is I think that we will see a dramatic number of covered entities submit Q1 and Q2. Related to the data piece, if 1/3 of covered entities submit, do they have the right, a maximum data group that gives them additional intelligence? There will be a point, I don't know exactly what, it's not about number of covered entities, it's about number of claims, that it will reach a tipping point to 340B ESP where they're able to answer questions like, how big is the 340B program? That is something that is contested over time. I think many of us see probably the most a number that many people look at is Adam Vine's number that he publishes, that he gets through the Freedom of Information Act. That is still a contested number as well. But that number then would be used for approaching our legislators, et cetera. So with, just like the covered entity community is at a tipping point of the number of manufacturers and that financial impact to you, I believe there's also this amount of data from transactions that would reach a tipping point for 340B ESP to do a variety of things like go get new manufacturers, be able to publish a white paper from it, et cetera.
Okay, great. Sounds good. Let's move into another question. We have plenty of them. Any thoughts on if there is a HIPAA compliance risk for covered entities with providing this data, pharmacy and claims data, that is, any of the data that helps pharmacy and payers?
From a privacy perspective, right? There is HIPAA data that you're uploading, and RX numbers of HIPAA data, so it's protected. There is a BAA you can sign with 340B ESP, like any of vendors you might be able to give that information to. So it certainly has to be a conversation as a part of that discernment, what they say they'll do, and then what you trust that they will do.
Excellent, thank you. Do you know how quickly after registering and or uploading claims was the 340B pricing restored?
Not yet, because we're still kind of within that 10-day window. I will note that I don't expect every manufacturer going at the same time. So it's a manufacturer by manufacturer approval. So it'll cascade. But 340 BSP says they expect all of the manufacturers to be done within 10 days.
Okay. Pam, this is a question for you, for Day Kimball. How much did the commercial rebates cost you on your employee health plan?
We don't have those totals yet. I can get back to you on that. I'm not quite sure.
Okay.
But it was fairly significant, but I don't have any totals.
I think the most important thing to note to the group is it's very rare that the rebate is worth more than the 340B price delta. So it's never going to be more than the 340B price. So that's something to keep in mind as you estimate. Oftentimes you may not get the claim level data, or you might, depends on what you can get.
Okay, great. You guys will do our best to answer every question live. And if we cannot, we're going to compile those answers and send them out as we've mentioned. Moving on. Once registered with ESP, were you able to look back and recoup qualifications?
Go ahead, Ashley, look like you want to answer that one.
Oh no, that's good question.
Good question. Yeah.
Yeah, Pam, I'm interested if there's anything is this all on a go forward basis, or is there anything retro that one can capture with ESP?
Well, I'll start, Pam, you add on to it, and that there are a few policies that actually state that there's a date range moving forward, but it's all centered around purchasing, right? Which, that's what you're trying to do. So I think it's fairly easy to get away with qualifying your claims to build an accumulation to then be able to get back. Over time, will 340B ESP and manufacturers say, hey, you're buying X volume and you're only uploading Z volume and there's a big delta? Maybe, right? It all kind of depends on how many analysts in the background are they really doing, and do we really anticipate a covered entity that has made the decision to give some data? Are they going to choose to scrutinize them at the chance that may scare other covered entities off from doing it? If I'm calculating in their shoes, I don't anticipate that they're going to come to covered entities and give a lot of grief, because they want that experience for covered entities with 340B to be cordial. Otherwise, it may be another con that stops someone doing it. So it's not clear on qualifications in a lot of the policy statements. Pam, I don't know if you want to add anything to that.
Time will tell. Yeah, unfortunately, we just started doing this. I think the 16th of January we uploaded. So we're still even in that 10-day time frame. Hopefully, but there's no guarantee with any of this, obviously.
Can I add a conspiracy theorist idea?
Of course.
So we saw in the last 2 weeks, or maybe less than a week ago, that there were terms and conditions that were changed retroactively for those who had participated. So that was, big in the community of, ooh, I'm scared a little bit more, because if you can change that on me after I've signed the contract, what else might you do? That term and condition that changed was language that was something to the effect of, this data can be used to evaluate and determine your compliance with manufacturer policies. One of the ways that manufacturers look at your compliance in a variety of ways is a simple math equation, similar to what Jake said, of let's take X input and compare it to Y output and compare that. I'm familiar with several manufacturers doing that for evaluating duplicate discounts because of the chargeback data. That's how manufacturers get the data from wholesalers, and they know how many things were got at a particular a reduced price. And so that could be something where those two things are compared, whether it's qualifications to purchases and identifying, I don't know, that would be diversion, looking at Medicaid, looking for duplicate discount. And then in general, on looking back, if you are utilizing maybe past accumulations or accumulations outside of a particular window. So it's a worry.
For sure.
Okay, great. Thank you for that. Will manufacturers agree to receive data and provide 340B pricing for some contract pharmacies if only certain chains are willing to provide it? For instance, CVS will share, but Walgreens will not, or vice versa.
Yeah. So right now, when you go through the process, there is not a mechanism if you upload claims to designate which pharmacies you will. So no, not right now. When you're submitting data, will that be done? Operationally, right, is then Walgreens, where they sit today may be different where they sit, after they see all you at the coalition complaining about this, right, is maybe that will not be the case moving forward, I'd hope. So you will get that functionality. So time will tell on all the TPAs, right? They all have to figure out their IT infrastructure to make sure that they have the functionality that can be customized for different manufacturers for different covered entities versus across their entire platform. So not easy job for them right now.
Okay, excellent. Here's the two-parter. Does the February 1st deadline for data submission for AbbVie mean that I need to submit historical data to them by February 1st, or does that just mean I need to register? And the second part is, I heard a rumor that the 45-day grace period for getting the AbbVie data uploaded. Is this true?
Well, here's the thing here's the weird thing about uploading data is that how does anyone ever know? How do you know you got it all? Right? How do you know you copied all 40 columns and not the first 20? Right? And how are they going to ever know that? I mean, I guess, right, they could do this big audit that would take a lot of time, would only be worth it if there was this blatant thing to go forward. So there certainly is this manual aspect, and trust in what you're uploading is all of the claims. Again, could they look at dates and not go back? Sure, that again, that might be how they go forth and do that. But at the end of the day, these guys these manufacturers, they just want us to upload the data. So again, if you upload the data, I think you can take advantage of it. That's what I'll say to what you're comfortable with as an organization. I don't think the manufacturers, AbbVie's going to come back and beat on covered entities for not doing it correctly one time at the get-go. If they see your submitting data routinely, that's what they want. That's not going to be their attention to micromanage that. I think they're shifted more towards, getting more of it. But that's just my personal opinion. Ashley, Pam, please chime in if you feel, slightly different or, add to it.
No, I completely agree. They have no idea how many we uploaded or if we gave that all to them or not. It's the own covered entity's choice as to whether they're going to be honest and truthful or if they're going to cut the curve.
Next question.
Of course. Is 340B ESP requiring your clients to upload data for all contract pharmacies or just those that have been designated for the manufacturer?
It's just if you comb your own data to only the manufacturer, great, you're going to submit 40 claims and it's going to descramble 40 claims. If you do a 40 that are impacted and 80 that aren't, it's going to only descramble the 40 and it's going to kick the other 80 out when you upload the claims. So so far, from our experience, make it easier on yourself and don't take that data away. It looks like the non-impacted manufacturers get scrubbed out.
Okay. I'm going to ask a question here that I don't fully understand, so hopefully you guys can pick me up. Do we need to have the individual HINs for each pharmacy NPI?
So the HIN game really only applies in that option 1 scenario where you're going to go select an individual pharmacy and then you've got to get an HIN. And if you've got Cardinal and ABC, you have an HIN, you just got to go get it. If you got a McKesson account, then you got to file and get one yourself. Again, the link will show you how to get there. But for option 2, the HIN's not needed. The manufacturers aren't requiring that to be in the ESP database.
I have a comment as a McKesson customer about the HINs. That is something that if you don't have one to get, Jake, it sounded like there's going to be a link on that. I recommend that is shared as a resource. That is part of maximizing your exceptions. So I know that you asked about in ESP, but for those of you that are McKesson customers that are still on the fence and you aren't sure about having maximized your exceptions, if that's, we spent a lot of time trying to find it, saying, maybe our GPO has it, McKesson, like somebody give it to us. We ended up going out and registering new ones because it was going to be faster. And so I think it's like HIBBC website. It wasn't super fast, but if you don't know what they are, I do recommend to just start there to get new ones.
Yeah, the link will have a blog. It actually will kick you over to the link PEX has put together. A really fantastic video explains HINs and why they exist, and so you can watch that 8-minute video and then we summarize it. So that information will be in this PowerPoint.
Oh, we got that one. Can we scrub the data ourselves before submitting them to 340B ESP?
Yes.
Any clients successfully included an NDA as part of their 340B ESP contract?
Not that I'm aware of. Panelists, chime in if you are.
No.
No to NDA. I do recommend, I've talked to a number of external legal counsel who is advising folks on this matter who have commented that they have been able to get certain red lines in not just the BAA, but terms and conditions. So try for it all, because I think that we are in this before the tipping point of data. Another conspiracy theorist model here is the willingness to get people to get data, and the willingness and having 340B ESP be friendly to that. And then eventually it's, no, I know we got you. I'm not going to agree to anything. So that there's a timing element to that again, conspiracy theorist.
How are reversals handled?
I guess I depend on the perspective, right? Is that you simply could just, if those are in your qualification reports, you'd include those to be in. And so they'd show up as a negative back when you upload the data. So it would really just be the same as a normal claim, just be reverse negative.
And you guys, we have about 5 minutes left. We're just going to ask questions to the end. I think there's a lot of value in covering as many of these as we can. Why do you think ESP asks for the wholesaler invoice?
More data to reconcile, but it's not a
Mhm.
required field, so I wouldn't give it. But Ashley, go ahead.
I think what the why of that is when we're working with the manufacturers, if you've ever done a repayment, the time that at which you bought it is important. So what was the price on that day that you bought it? Because we know that pricing changes quarter to quarter. So I think that's part of the tying price bought, the date of that, and the date could, when we're talking about rebates, match that then with, all right, what date are we talking about with what agreement they had with us, with a PBM and other stakeholders.
Would the upload just be for sold claims? If not, how are pharmacy reversals handled? I guess we.
Or same as the reversal question.
Yeah, okay. Was there something else on that before I move on? I thought I heard.
Nope.
I've spoken with several grantees, FQs, that have been affected by blocked NDCs. Is there a miscommunication there? Could they potentially be exempt from block NDCs and not know it?
Most certainly, right? Because this has happened on this massive scale, and so accidents happen, counts get carved in, carved out. And we've known covered entities that weren't impacted for many, many months, even after the effective policy date, because their account somehow didn't lose the pricing for a period of time. So absolutely check, whatever circumstances you're under as a covered entity, even if you're a grantee or not, and the dates that things happen, and then work with your wholesaler to backdate and correct those things if mistakes happen. It's not uncommon.
Do you know if any entities have had success in amending the 340B ESP terms and conditions?
I think Ashley, you covered that one.
I can't tell you exactly what.
Okay. We need to backdate our claim upload and access accumulations on our TPA blocked last year. Will we need to backdate our claim upload and access accumulations on TPA blocked last year?
Well, if you want to try to carve back in time, then you've got to be able to do that, to have your audible records and your accumulations to then split and buy off of. But if you're going to simply just move forward as a new year, say January 1st, and move forward, well, then you wouldn't need to go back and upload data that you don't really going to do anything with. I wouldn't qualify claims that you're not going to purchase.
Can you pick and choose contract pharmacies you submit data on, or do you have to submit data on all contract pharmacies?
Yep. Right now, it's all, assuming you're uploading it all into ESP. But ESP does not let you select ones you're willing to send to and which ones you aren't.
If we decide to designate one contract pharmacy, how specialty pharmacies that don't carry the same formulary are handled? I guess, how are they handled?
I think the manufacturers are hearing that issue, which is why Novo changed their policy this week to allow you to add a second specialty pharmacy into your account. So it's a hard one, right? Because some of these drugs are they're dispensed out of a location with a common disease state, and so you get drugs that are kind of all over the country. That's the hard model. It makes this complex on where and which of those options, one or two, is best for a covered entity.
All right, looks like we have time just for a couple more, and then I'll leave it to you guys for final thoughts here. Any experience with credit rebills with manufacturers after 340B enrollment? Can you credit rebill for missed claims back to an arbitrary date, or can you only credit rebill back to the effective enrollment date with 340B ESP?
I'm just trying to understand that scenario. Why you'd necessarily need to credit in rebill. You certainly could attempt to do that. It gets really hard because if it's all on your account, usually you only have one 340B account, so you're not crediting and rebilling to the same account. It may be a price file issue. But if you simply didn't get the 340B price, but you got decremented on your 340B accumulations, then I would document that and I would just add them into my accumulator, and then they'd split the next time you needed the drug, and just do that all yourself and not put that work on the manufacturer. I'm sorry, on the wholesaler. But if it's a rare drug that you may not buy again, well, then certainly try it and follow the policies with your wholesalers. They certainly do credit and rebills. It's just not as common in that contract pharmacy account game, because some of the scenarios, it doesn't make sense. But I'd try to avoid that if you can. Document that the price was wrong. It wasn't really a 340B price, even though it was bought on 340 account, and then add that into your accumulator with that documentation, and then there you go. It's going to happen once that price is loaded.
Hey, Pam, Jake, Ashley, we're at the hour, so why don't you guys, and we see a couple people dropping off, but there's still very many people on, but why don't you guys, just by way of final thoughts of wrapping it up, if there's anything you want to share. We have a lot more questions that we will get to, either through written answers or publishing some of that publicly on social and in different means. Why don't you guys just add some final thoughts before we let everybody go?
I can go. I'll go first, and I'll let you guys end it. Thanks again for coming on, everybody. This is time worth your investment. As much as all of us want it to go away when we go to sleep tonight, it's not going to go away. It's not going to get any simpler in 2022. Policies are going to change, and manufacturers, what TPAs can and can't do, what 340 BSP wants and doesn't want. It's all going to change. So you got to get in the right mindset. You got to ride this wave. Try to stay organized, stay up to date. I'd anticipate other vendors in the space, right? If 340 BSP is making money, other people are going to want to do that. So there's other vendors that are going to be looking in the space. So this is certainly a topic that's worth staying up to date on. And so thanks again for tuning in and listening to us today. Ashley, you're next.
This may be a very lonely position to feel like you're in, and I felt like that for a minute, and then I thought, we say this all the time, it is more than just pharmacy that runs the 340B program. Reach out to your leaders, reach out to other stakeholders and folks who make decisions to make that decision together. If you have a type of steering committee, this is for that committee. It is time to call that meeting, call an emergency meeting. If you feel that your finances just in the month of January are really getting to a decision point. So you're not alone. And thanks for your time today.
Pam?
So backing on to what Ashley said, you're definitely not alone. Our 340B steering committee was crucial in helping me make this decision. You just have to do what makes sense for your own covered entity. Whether it's holding off and holding tight like Ashley did, or whether it's, uploading for now until we see where it lands, and maybe Dade Kimball ends up not having to upload in the future. We can only hope, right?
Right.
All right, well, that's it, everybody. And I just really want to do a special thank you to Pam and to Ashley for joining and adding your unique perspective from the CE and your contributions. Jake, as always, thank you. And everyone who attended, several hundred of you, thanks for everything and all the questions and for sharing your time with us today. Look for future webinars and educational programs from us in your inbox. We're happy to share this information with you. And this recording will be emailed to you. You can download that and view it again or send it off to a colleague. The handout is available in the chat box right now. And we appreciate you spending time with us today. Thank you, everybody, and have a pleasant rest of your day.